Magnetic resonance imaging, commonly known as MRI, is a highly advanced, non-invasive medical imaging technique. It is used to produce detailed images of internal organs, soft tissues, brain, spinal cord, and joints. MRI works without using ionizing radiation, making it one of the safest diagnostic tools in modern medicine. An MRI machine consists of several important components. The most important part is the powerful magnet, which creates a strong and uniform magnetic field. Gradient coils help in spatial encoding of signals, while radio frequency coils, also known as RF coils, transmit and receive signals from the body. The patient table allows precise positioning of the patient inside the scanner. Before the scan begins, the patient is positioned comfortably on the MRI table. The specific body part to be examined is placed inside the magnetic field. Specialized coils, such as head coils or body coils, are used to improve image quality. The table then slowly moves into the MRI scanner. The received signals are processed using advanced computer algorithms. MRI images are produced in different planes, axial, sagittal, and coronal, providing excellent anatomical detail. Different sequences, such as T1-weighted and T2-weighted images, help in identifying various tissues and pathologies. This makes MRI especially useful for soft tissue evaluation. MRI is widely used in diagnosing conditions related to the brain, spine, joints, muscles, tumors, and blood vessels. One of the major advantages of MRI is that it does not use ionizing radiation, unlike X-rays or CT scans. However, patients with metal implants or pacemakers must be carefully evaluated before undergoing MRI. In conclusion, MRI is a powerful and safe imaging modality that provides detailed insights into the human body. Understanding its working principle is essential for accurate diagnosis and patient care.